You can expect to have some pain at your incision site and joint after surgery. It's also common to be sore in other parts of your body, depending on the way you are positioned in the operating room. The experience of pain is different for everyone. Although you will not be pain-free, it is very important to us that your pain is under control. We believe in a team approach to pain management. Your team includes you, your nurse, your physical therapist, the doctor, and a nurse practitioner or physician's assistant. There are major advantages to having good pain management. These include early ambulation after surgery, getting a greater range of motion in your joint, and improved sleep and well-being. Poor pain management can cause decreased ambulation, mobility, and range of motion in the joint. All of these can cause an increased risk for blood clots and irregular scarring of the incision, so this is something we take very seriously. Pain management is a key part of your care. You and your healthcare team will work together to manage your pain and ensure a smooth recovery. You will be frequently asked by your nurse to rate your pain on a number scale from 0 to 10, with 0 being no pain and 10 being the worst pain you've ever had. This will help your nurse know how well your pain is being controlled. If you are not comfortable, tell your nurse right away. Your pain control is very important to us. We want you to be comfortable so that you're able to progress appropriately in the rehabilitation of your new joint.